If you have hives, I know you're miserable. Hives are because histamine is released into the superficial tissues of the skin. It causes little itching welts. They look like mosquito bites. You may have 100 of them. They may be very small, about this big, or they may be bigger, or they may be huge hives. The size of the hives is not important. The cause of the hives is because of release of histamine from those mast cells. Causes tremendous itching, just makes people absolutely miserable. A twin to hives is sometimes what we call angioedema, where a lip may swell shut or an eye may swell shut. That's because histamine is released into the deep tissues. Now, what can cause hives? The world literature says, and this is the bad news, 90% of the time nobody finds the cause of hives. So in general, we're not going to find the cause of your hives, but a careful history is needed and a physical exam is needed before we can determine if some of the unusual causes we can find and get rid of your hives. Let's look at some of the causes. Number one would be foods. There are 8 major foods that can cause problems: egg, wheat, corn, milk, fish, nuts, and soy. Now, the nuts could be tree nuts or peanuts. So that's a total of 8. Those foods frequently cause allergic reactions if somebody's truly allergic to foods. 4% of children will be allergic to foods. 2% of adults will be allergic to foods. 8 to 12% of the population think they have food allergies. Usually, they don't have food allergies. But foods can cause hives, and therefore food skin testing may be needed in your case. Number 2, infection. Any type of infection can cause hives. It may be a simple common cold. It could be a bladder infection. It could be a stomach bug that you have. Or it could be a skin infection. Infection can cause hives. The body begins to react to the infection, and in the reaction, the immune system can trigger off an allergic reaction. Foods, infections, medications. In the old days, penicillin shots used to be a common cause of hives. But any type of medication you take can cause hives. So sometimes we need to avoid certain medicines and change them around and add them back and forth. If you have angioedema, swelling of a lip or an eye, frequently an ACE inhibitor medication is a cause of that. So foods, infections, medications, hay fever time of year. Sometimes people that have grass hay fever, they go out and mow the grass and they get runny, itchy, sneezy hay fever symptoms, and they break out in hives also. And then there are some miscellaneous causes, some rare causes. Actually, ultraviolet light from sun can cause hives in some people. Vibration can cause hives in certain jackhammer people. Any kind of vibration can do that. There's a cold there to carry. Sometimes touching cold can produce hives. Very, very dangerous if somebody would go up the mountain and get in a swimming pool where the whole body would be immersed in cold. They can get a tremendous allergic reaction, and it can actually cause somebody's death. So hives can be a real significant problem to your health, but mainly they just make people miserable. Excellent treatment for hives. That's the good news. If we can't find the cause, after doing blood work or after doing skin testing if needed, after a careful history and physical exam, there are good medicines. Number one, there are excellent antihistamines that can help suppress the hives. A lot of times, if we can keep the hives away with medicines on a regular basis, they seem to forget that they were coming out so frequently, and they'll go away and they stay away. So we usually use Zyrtec. There's now generic Zyrtec called cetirizine. You can actually get cetirizine at Sam's Wholesale Club. You can get 350, that's one a day for a year, for $17.31. And you don't even have to be a member of Sam's. You can just go in, tell them you're going to the pharmacy. That's cetirizine. You can talk that over with your doctor. It's an excellent antihistamine. 14% of people get sleepy. You never know which one of those 14% you're going to be. If it makes you sleepy, we take it at nighttime. If your hives are terribly bad, sometimes we start off with that Zyrtec or cetirizine twice a day, morning and night. Now that blocks what we call the histamine 1 sites. In the skin, which is where the hives are, there's a histamine 1 and a histamine 2 site. So sometimes we have to also add a histamine 2 blocker. Histamine 2 blocker, interestingly enough, are the medications that we use for people that have heartburn and acid indigestion. The Zantacs that we have, the Tagamets that we have. I like to use generic Tagamet. It's called cimetidine. And we take it twice a day and the Zyrtec twice a day. And the combination of those medicines sometimes make your hives go away. Stop the medicines, they come right back. So we have to take them for a period of time to get the body used to not having hives. If you've got hives, know we've got good medications. If those 2 medications don't work, we've got other good medicines that we can use. So we'll work out a program for you that will allow you not to be miserable and live a happier and more productive life, hopefully without hives ever again.